This is a COVID-19 update press briefing from October 21st, 2021. The governor opened the press conference saying good afternoon to everyone. He explained that one of his priorities when he became governor was that he wanted to see all students be able to stay in the classroom, not have some in the classroom and some who were remote distance learning at home, but to be able to have all the children in school throughout the struggles with COVID. He is aware that distance learning is really not the same as the in-classroom experiences. Students learn better when socializing and in school, and he understands that. And he wants to thank the many, many different people and teams for their hard work to ensure students were able to stay within the classroom and get in-person learning. And he is thrilled to announce that they have set up a new pilot program called TTS, which you may wonder, what does TTS stand for? That is a new term called Test to Stay. Rhode has collaborated with Westerly, the school district there. They were willing to be the first district to pilot the program to go forward with the TTS, Test to Stay. This is a new concept and a new way to make sure that all students are able to be in the classroom as much as possible. And this program will be set up in such a way that from pre-K to age 6, that age bracket, those children who have yet been vaccinated, they are still able to go to school, but they will take tests every day. Suppose one student in their classroom becomes positive, then you would consider the others in that classroom called close contacts, meaning you would have to close the classroom, send all of those close contacts home, and quarantine them for 17 to 14 days before they could come back to school. With TTS, the goal is that if you have one positive child in the classroom, you would test all the other students and they could stay in school. Plus, you could have that other student go home and quarantine. So that is the goal. So that will start today. There will be an evaluation for 1 week to see how TTS is running, and then that will be spread out to other school districts in Rhode Island. This pilot program requires that the parents sign a permission form. So deaf parents, when they ask you about TTS, to sign it, because those children have yet to be able to be vaccinated, we encourage you to go ahead and sign the form that says, yes, your child could go through the TTS program. That will be helpful to families, especially those working parents who have to leave the home to go to work. And if the kids are home on quarantine, even though they tested negative, this is hoped to be helpful to lower the stress level for those parents, because the child could stay in school as long as they tested negative. Second, the FDA has already approved the vaccine for children 5 to 11, just for Pfizer. For 5 to 11, that vaccine has been approved by the FDA. That now moves on to the CDC ACIP committee. That will happen on November 2nd and 3rd. They will discuss it. And then if it's approved, then the Department of Rhode Island is ready, the state of Rhode Island Department of Health is ready to move forward as soon as November 4th with providing those vaccines to children. If you remember, we said there's about 80,000 children in Rhode Island from 5 to 11. And I said that in those first couple of weeks, we will not get enough vaccines for everyone. Pfizer hasn't even started making the vaccine yet. They were waiting and are waiting for the FDA and CDC approvals before they start producing the child's vaccine. So we will get about 9,000 doses of the vaccine every week, equal with other states for their populations. And that will happen the first few weeks until Pfizer has enough vaccine that all the states will be provided enough to vaccinate all of their children. The governor is asking you to please be patient with appointments. They may fill up for the first couple of weeks, but that system and problem should resolve itself by the CDC. The last thing that he spoke about in the press conference was Halloween. This year, Halloween is much more safe than it was last year. Definitely much safer this year, but he still warns that there is COVID out there. The Delta variant is also out there. And although Halloween tends to be an outdoor activity, which is a great thing, we still encourage the children to wear masks when they go out trick-or-treating. If they're wearing a Halloween mask, perhaps the COVID mask could go underneath it. If you have plans to have children come into the house to get candy or cookies or sweets, he encouraged you to pre-bag the candy and have it set up so the kids can just come pick up one bag and leave and not touch other candy that might be in the bowl for choosing. And those kids who have yet to be vaccinated, we're asking especially that they please wear masks. Protect yourself and protect others by wearing a mask. So he wanted people to enjoy Halloween, to play safely, to wear your mask. And one more thing, if you're going to be hosting an indoor Halloween party, that's fine, but please make sure that all of your participants and guests have been vaccinated. If not, we suggest that that person definitely wear a mask or not come to the party at all. You want to make sure that everyone at the party is vaccinated to be safe, because we are yet to be out of COVID. Happy Halloween, everyone.